All right, we're back. Sorry. So in terms
No.
of we just got cut off, Keoni, where we were talking about the location of where you want to dry needle and what the reasoning for that is. I will
Right.
dry needle mostly for this issue, golfer's elbow at the tendon. And this is what throws people off and why I was harping on the fact that that tendon attaches above the elbow. Most people, and just using my pickleball guy as an example, he gave me location of pain more so along the ulnar border, like I was talking
Yeah.
about. Now I
Yeah.
could palpate and touch painful spots and make pain come on, which is kind of part of the evaluation. We want to kind of see what we're dealing with. And if I can recreate the pain and take the pain away, I've got a really good idea of what I'm changing there and how the dynamics are changing what you may or may not be feeling and what that tells me. But a lot of times they do report some discomfort kind of along this ulnar border. But I most often needle at that common flexor tendon, which is going to be at that medial epicondyle of the humerus, which is above the elbow. Now
Which
I
is
did,
above the elbow, right? It's not in that canal where where
yeah,
you have the
please.
ulnar nerve coming through, right?
Yes.
Well, I
Yes.
bring that up because a lot of acupuncturists, a lot of people have the pain there, and if you're not careful, you're going to hit that nerve.
Yeah. Yeah. And you will feel that for sure. You'll definitely
Yeah,
feel
you'll be
that.
on the ceiling, but it really is up in this area, right, where you're getting at.
Yeah, and people, if as they're listening, they can try and find it. So the motion that these muscles are going to do is flex your wrist, right? So I mean, you can work your way feeling the elbow and work all the way above your elbow, and you're going to feel those tendons get a little tighter, at least from that
Okay.
contraction underneath, and kind of feel where they are.
Are
Um,
you are you dry needling with this particular case? Did you dry needle around here too, or did you just stick
this
here?
particular case did not want to be dry needled, so I used all
Oh, okay,
manual
okay.
treatments and did
But
not use dry needling.
would you have gone here? Any reason? If the pain is here, would you have treated the
Yeah,
painful area?
so I would with manual. I probably am not going to dry needle that area right now.
Okay.
Because I am trying to, and it goes back to where we found these people, which most people are coming to you or I 4 to 6 weeks into this process. So more often than not, it is not a reactive issue at that point, and we've got to kind of stimulate this healing. And whether or not they feel the pain here, the issue is coming, the changes are
Yeah,
happening in that tendon. And if we
yeah,
can get that, because what can commonly happen here, what I hypothesize is going on is that if we've changed how this tendon works, and I talked about if we're losing two of those fibers attaching to that
yeah.
muscle, we're changing the dynamics of that. Maybe
Right.
the muscle belly and those muscles, the myofilaments and what works, which muscles work like Velcro to attach to each other and
Mhm.
create tension within the myofilaments, within the small contractile pieces. And with that, I feel like as we change the tendon dynamic, maybe we can get some disruption in the muscle belly in terms of how that is working. And so you may get like a tight nodule, a painful spot along that ulnar border. And what I will do is I will manually treat that because it feels good and it does help. But I'm more often than not dry needling into that. I'm going to start dry needling the tendon. If I feel like I'm not getting results from that, I may dive into the muscle belly. 60% of the time, I needle a tendon more than
Okay.
anything else.
I don't want to go off on a tangent here, but I just want for our listeners, just want to contrast because I do acupuncture. I just want to contrast what you do and then what I would do with that. And I don't know much about dry needling. So when you dry needle, you're actually going into the tendon. Are you like threading that needle? Are you stimulating that needle for like 2 minutes, 5 minutes? I mean, like what I do is I will needle that area, run electrostim over it, but I'm not, I leave them in the room on the table for like 20, 30 minutes, right?
Yeah.
But you're actually there like working the needle. Is that correct?
Yeah, so specifically for golfer's elbow, specifically, it is correct. I'm working the needle. And what I'll do primarily talking just about golfer's issue, a lot of different techniques that I'll use with the needle depending on what I'm doing. With golfer's elbow specifically, I will use two techniques called pistoning, meaning I'm taking that needle and I'm just bum 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 bum, bum like going in and out of the tissue or really disrupting the tissue. You can almost think I'm just cutting it over and over again, kind of stabbing it.
Right, right,
That's
right,
going to help bring this inflammation process
right,
to it and
right,
help
right.
reorganize it. And then the other thing I'll do a lot is I will wind the needle. And if you
So you'll
get
twist it.
yeah, and you can feel that the needle starts to develop tension and it starts to grasp the collagen fibers of
Yeah,
the
I could picture the
tissue.
collagen like wrapping around the needle.
Yes,
Yeah.
exactly. And they have shown studies where they're taking imaging and you can see the collagen wind around the needle.
So, okay, so you do this. That treatment, like the actual treatment lasts a couple minutes then, right? Not even.
Yeah, 5 to 10 minutes maybe.
So you needle that tendon, you just do one repetition of that and you're done? Is that the treatment
In terms of so there's
of the
always
dry needling?
exercises to it, but in terms of the
Yeah,
dry needling,
that's it.
yeah, that would be it. And then I am gonna generally, more often than not, follow up that dry needling treatment with some sort of manual therapy with my
Like
hands.
gua sha or something or scraping.
Yeah, some like gentle effleurage, some
Yeah.
sort of myofascial
Okay.
release to kind of disrupt, because it is going to be painful, right? The dry needling, I am going to stimulate some healing. I am going to cause some damage, and that's what I'm looking
Yeah.
for. But it is going to
Yeah.
make you sore and tender. So I want to kind
Yeah.
of work some of that out so you're a little less sore and tender, and we're also not adding, fluid and
Right.
inflammation on top of this already
Right.
big issue.
Right. So to contrast that with acupuncture, besides the holistic nature of acupuncture, but people don't want, people come into me for golf elbow. They're like, get rid of my golfer's elbow. They don't care about all the other stuff. So speaking of that specifically, I would needle around the area and probably run stim on that. Insert the needles, run stim across that area and leave them there for like 20 minutes and then, end the treatment 20 to 30 minutes. That treatment contrasts what you're saying. What I do would be mostly pain management, right? I mean, it's not really getting to the root if you're not stimulating the collagen there. You right?
Yeah,
Am I correct saying
I would
that?
agree with you. And then in terms of
I think that's important for acupuncturists to know because a lot of them will say, oh, well, dry needling is just a form of acupuncture when it's really not. It's like you're stimulating. I mean, yeah, you're using a needle, but you're trying to get the body to go to the area that it needs to go to instead of just doing pain management.
Yeah, and I'm going into a specific tissue, right? And then you can correct me if I'm wrong, but to me, it seems like dry needling is generally a little bit more superficial. It's generally a little bit more, or I'm sorry, not dry acupuncture specifically, a little bit more superficial,
Yes.
and
Yeah.
not necessarily targeting a tissue, but targeting these meridian patterns
Right.
and how
Yeah.
how you use those. Um,
Sure.
and then with my experience with the needles and the electrostim, for this specifically, talking about golfer's elbow, this would be a good example where you would want to put a needle in the muscle belly and maybe a needle further up the muscle belly towards the tendon. And then if you're in that muscle appropriately using the E-stim, just so
Yeah.
people know, it should be uncomfortable. Like it should not
Yeah.
feel great. And it should produce a
Yeah. You
muscle
should feel. Yeah.
contraction.
You should feel the muscle
And in
twitching.
terms of what you're asking me, what would I do with someone like the golfer who has no choice but to go golf, the professional
Hmm.
golfer?
Yeah.
We're going to do that for maybe 20 reps, 10 minutes or something like that. And then they're not going to have to work, but it's going to align the collagen, get the blood flowing, and it's taking a load off them while still providing some treatment. So that may be something I would do with that example after they play that day.
Right. Right.
Um,
Right. Right.
and just that just adds to a little bit more of how we would go about treating it.
Yeah.
But dry
Okay.
needling, I see a lot of benefit from. And then, like I said,
Oh, so do I. So do I. I definitely I refer people to it. You know, and I'll even myself I'll use needling technique that is more dried needling into the tendons. But yes, somebody, it works great. It can
yeah,
work great, especially for athletes and people who are dealing with these chronic issues.
yeah, and especially you can see. I mean, that's why I wanted to. I didn't want to go into too much detail on what cells are doing and what proteoglycans are and bringing fluid into it. But in terms of you can see when we get this pattern and we understand that what's happening is a disorganized tendon,
Yeah.
we can easily see how if I can go in there and you can go in there with a needle and stimulate healing, we have the opportunity to kind of restart this process. If we're in a chronic situation, which is how most people do end up coming to us because it's been a few weeks, and then we eccentrically load through it and we work through it, and it does typically get better in 6 to 8 weeks as long as we're doing the right stuff.
That's great.
So just
Great.
a word on the manual, Keoni.
Yeah.
So in terms of what I'm doing with the manual, what I want people to know from this is not necessarily any right or wrong way. If it hurts and it feels good to rub on, it hurts so good, and then you stop rubbing on it and it feels a little bit better, cool. Roll with
Yeah.
that. That works for me. one thing I do want you to know is where those tendons attach to. So knowing it attaches above the elbow. And what I always do when I'm doing manual, when I'm doing foam rolling on myself, when I'm educating someone on how to foam roll, whatever the case may be, is you want to start proximal, which is meaning closer to your midline of your body. So if we're talking about the elbow, you're starting at the elbow or above the
Right.
elbow. And you're going to
Right.
start working those tendons with the lacrosse ball, a foam roller, a percussion gun, whatever you have. And you're going to
Mhm.
work distally, proximal to distal, meaning you're working from your elbow to your fingertips. And then you're going to work back distal to proximal. So you're going to make your way towards your fingertips, and then you're going to make your way back down to the elbow. And the reason I feel like that's so important is you're going to go through and you're going to stimulate and break down whatever it is and get fluid in the area and all this kind of stuff as you're doing this manual therapy. And we want to go back up in that distal to proximal way so we can help clear out that fluid and kind of return it to the lymph system and get it to these proper ducts and clear it
Yeah.
out. So really important to me that people know you want to work starting at the painful area and kind of above it and work down and then bring all that fluid back up so it can collect in your
Right.
common lymph
Okay.
nodes area and kind of disperse. And then you should be
Yeah.
less sore. It should be less painful for longer. My goal is not to make people sore from, not necessarily to make people sore from the manuals, but we got to do something that causes the right change or we're just wasting our time, which is why the needle becomes so beneficial for a degenerative or a degenerative tendon or tendinosis.
So proximal to distal, distal to proximal, and you're doing that after you do dry needling, let's say.
Yeah, I'm always doing it after I needle, and then like you mentioned with that pickleballer, he didn't want he was not willing to do a needle, so that's cool. So we just did manual, and he got completely better. And like you mentioned, some of that gua sha, that's when I started because I didn't have a needle. He didn't want to use a needle. I got a little bit more, I got some of those the instrument assist, where you're kind of scraping someone up,
Yeah.
and you're
Yeah.
you're just
Yeah.
able to get there a little easier because I'm trying to get in there and I want to change that tendon. I mean, I am
Right.
trying to get these collagen fibers to change via my hands. And that's why you
So
can
it's not
see it.
necessarily it won't necessarily be very comfortable with you
No,
doing that
yeah,
on. Yeah. Yeah.
yeah. This is not a comfortable, feel good massage. And the point is we want that because you need something to go in there and break down this thickened tissue and help reorganize it. And
Yeah.
that's what we're doing.
Very cool.
So in
Man,
short,
that's great.
yeah, in short, Keoni, just to kind of summarize what I wanted people to know is you've got these three phases of a tendinopathy, kind of, with the reactive, degenerative tendon and how they kind of flow through, and then being aware that you can get stuck in kind of in between reactive and degenerative based off your return to activity and how you go about pushing through or not pushing through pain with that.
Yeah.
The solution to this really, in my experience, is good, appropriate, specific manual treatment with good, specific, appropriate eccentric strengthening to that tissue. And then making sure you do use someone who can assess the load. And like I walked through with that pickleball example, when he came to me, it was like, all right, man, I need you to like for you to get the success you want to get, we have to commit to you cannot play pickleball for the next 3 weeks. I know that sucks. I hate being this guy. I never want to tell people not to do activity, specifically pickleball. I cannot have you do for the next 3 weeks so we can heal this. And then it was slowly, I worked with him for 6 weeks, once a week. And then it was okay. So we got past those 3 weeks. And like I said, now let's play pickleball. Can you play for 20 minutes on Monday? And if that's not painful, can you play for 20 minutes on Wednesday and 20 minutes on Friday? Cool. That was not painful. Then we'll add, can you do 40 minutes next week? Those three
Hmm.
times a week. And then we'll
Hmm.
slowly build that up. And then it got to the point where, hey, I'm gonna meet you at the gym for this treatment session. Bring your pickleball racket. We're gonna attach the cable to the racket and you're gonna start loading up like that through that and really
Right.
developing strength past where you were. And then I'd be
Okay.
remiss if I didn't say it's important to look above and below, right? This is why it's important to have a movement expert because there may be something happening at your shoulder or there may be something happening at the wrist or the fingers that's kind of impacting the biomechanics, the arthrokinematics, the joint movement of the elbow that can kind of change your likelihood to get all this stress through that common flexor group.
Right. Right. And yeah, so and if you let this stuff go on long enough, it does impact your, does impact the totality of your structure, the body, right? If you
Yes,
if
if
you
you
don't
let it
take
go on
care of
long
it.
enough, that tendon will get thicker, that tendon will get weaker, that tendon will then be so thick that it's hard to reorganize in terms of the collagen. And that's
Hmm.
how you get to a point where you see these old guys lift up a shopping bag and they tear the tendon completely, and then they have like a tendon repair surgery. And
Yeah,
I have seen examples of that where it's like, this is a golfer who golfed for 40 years, had some elbow pain, never did anything about it, stopped golfing because his elbow and his back hurt. And then one day he just went to grab, a big bag of groceries with the watermelon in it, and it ripped the tendon. Because there were so many degenerative changes that were never ever addressed, and thus
right.
the
You're
tendon gets
so
weaker.
Yeah. Okay. And when you told your pickleball player 3 weeks no pickleball, you're treating him in those 3 weeks? Are you doing once a week, twice a week? What I mean, do you have a recommendation on that?
Yeah, so it really depends, and this is where my business is a little different because I go to patients, I see them one on one. So like most people are really aware of how it works in a typical therapy session where you go 3 times a week for 6 weeks and there's like 50 people there and maybe they're with you one on
Yeah.
one for like
Yeah.
five
Yeah.
minutes.
Right.
So I do a lot more education, and this patient specifically was doing 2 to 3 exercises every single day on his
Okay.
own, and then we took a video of. And then I was coming in at least once a week for these touch points to do the manual treatment, progress the exercise to the next level, whether it be just through load, repetition, or whatever the case may be. And then making sure we were kind of pushing towards getting to pickleball at the right level and making sure we were getting past. I don't want to work someone to where they feel like they get better and then their tissue's at the same strength that it was when this happened, and then they go out and they play 6 hours and this happens again.
Right.
But
Which I see a lot. You feel good and then you go abuse it again. Yeah.
yeah, yeah. And that's where you really want to start when, if this is you, you really want to start slow. Be patient with it. Be a friend to the elbow. That's one of the best things I can tell you is you just want to be a friend
Yeah, be
to
a
it.
friend.
Yeah.
Yeah. Get away from that walk it off mentality, right?
Yeah. Yeah, absolutely. So I know that was a lot, Keone.
That
Any
that
other
was
questions?
great.
Anything
That was
else?
great. I learned a lot with that. I'm gonna for some of my treatments, I'll change some things up based on what you were saying. Yeah, that's incredible. And it kind of, depending on what your injury is, any tendinopathy, a lot of this you could probably utilize also from
Yeah,
this
100%. Can
talk.
apply it to
Yeah.
any tendon, whatever your tendinopathy is. Google that muscle and it'll
Yeah.
tell you like the muscle action. And then you can
Yep.
look up eccentric strengthening for it. And that's how you would really go about doing it. And then you can work a lacrosse ball, a foam roller. A lot of people have those percussion guns these days, those massage guns.
Yeah, I have one
Um,
at the clinic. Yeah, I mean, I actually use that quite a bit now too.
Yeah. And all that will help. The most important thing to know, I feel like for general people, is just know that a tendinopathy or a tendinitis, a tendon issue, generally the tendon's getting disorganized. It's your job to go in there and reorganize that tendon. And in that same vein, you're playing a management game of monitoring throughout the injury of how much load is appropriate, not appropriate. And that's obviously where an expert like you or I can really come in and assist somebody.
That's great. Yeah, I think it's great because one of the one little comment here is I know like the conventional treatment is usually, I have pain wherever it is, and it's like anti-inflammatories, steroids, and you know, I guess it's changing more now. Most primary care docs are starting to refer to PT. It'd just be nice if that was reversed, right? Where they saw the PT first and the PT could tell them. Because
Yes.
honestly, it is like, go to your anti-inflammatories no matter what your pain is without, and that may not necessarily be the best thing to help you heal quickly
Yeah, as a
as you
matter of
think.
fact, just before we hop off, Keone, I saw a study. I didn't write down whose study it was and whatnot, so people can look this up if they want to. But specifically for the corticosteroid injections, there was a study done that showed if you just get a corticosteroid injection alone with no other treatment, you may end up being worse off. And we know
Yeah.
that corticosteroids
Yeah.
an increase in those can decrease soft tissue quality. We can
Right.
see how that would be an issue in this
Yeah.
situation.
Yeah.
Um, it's all about realigning the collagen and getting the tissue working at an appropriate level and managing it along the way. Typically, if you're doing the right stuff, 6 to 8 weeks and you're good to go.
Cool. Awesome.
Cool. Well, thanks for listening, everybody. Feel free to reach
Yeah,
out if you have any questions specific to your issue.
glad to be back, man. It's always an education with you, Brian. Thank you.
Yeah. Be well, everybody.